Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
We'd like to demonstrate for you this morning the taking of an impression with alginate. Anytime we're taking impressions, one of the first things we want to do is to examine our patients for abnormalities, particularly bony defects such as tori, which are most common in the mandibular lingual area, and also for maxillary tori. If these are present, we have to modify our tray sometimes to meet them. Next thing we need to do is to select some trays. Usually there are many different types of trays, and sometimes these will range into the hundreds if you're looking at buying them. And we will need to select a tray that's slightly larger than the arch. And this should be pre-tried, just to make sure that it's of the right size and that we can insert it without causing any discomfort. Now, in taking of impressions, it depends on the purpose for which we're taking the impression as to exactly how we're going to take it and to what degree we're going to trim our trays. If we're going to be using our impressions for study models, such as these, you notice that these has a large peripheral roll on them. It shows the bony formation around the teeth rather significantly. This is used in study models and used rather extensively in orthodontics. If this is the purpose for which we're taking it, which is what we'll be doing in our hygiene course, then we'll want to get a rather large peripheral roll on our impressions. Now, they make trays specifically in the last few years that have extensions on them that are extending well into the vestibules. And some of these are made of Teflon and have very few holes in them, which allows for good compression of our material when we're inserting it into the mouth. But these need very little trimming. The trays we will be using are the trays that are supplied by the school. They're a little older, a little cheaper, and probably more commonly found in practice, really. And these are the trays of coal, and there are multiple perforations on them. We will be furnishing you with some rope wax. This is generally soft rope wax. We'll make this available in the lab, and we'll ask that you trim some of your impressions at least in this rope wax. If you trim them all, it's going to become a problem because you're not going to get a good impression the first time, and we could run through a half a ton of this wax, but we want you to learn to trim some of these trays with this soft rope wax. And basically this is just applied to the peripheries of the tray, which helps to build up the peripheries and extend them. It also helps to soften the peripheries so that if you do bump into any of the bony support around the teeth, that this does not impinge quite so much. Now, this tray should be adequate enough to get a good peripheral roll on these. I'd like at this time to have Dr. Craig show you some of the mixing techniques and demonstrate a mix for you.
Geltrate is supplied in a powder and in general is supplied in a large can such as this. It also is supplied in pre-weighed packages in foil, but the most common packaging system that you will find in the dental office will be this large can. The powder is mixed with water and then is spatulated, and after complete spatulation of 1 minute for the regular set material, it is placed in the impression tray. What I would like to demonstrate is simply the mixing of alginate with water. The dispensing of the powder is done with this small cup. In order to be sure that you get the same amount of powder each time, the can of Geltrate should be aerated. So it should be turned over several times before using this powder dispenser. Before we make the dispensing with powder, however, you should dispense the water. The manufacturer supplies a little cup with 3 marks on it. The water level for this particular mix will be for a full mouth impression, so we will use 3 scoops of powder, and we will use 3 divisions of water. In other words, 1, 2, and 3. The water temperature should be checked because high temperatures will accelerate this setting reaction. So the temperature of the water should be about 70 degrees Fahrenheit. We take the 3 measures of water then, the 3 levels. This is poured into a rubber mixing bowl. Then we will aerate the sample of alginate. The scoop is lightly placed in the alginate can. The cup is gently tapped with the spatula to remove large voids and then struck off flush. We will use 3 of these scoops because we are using 3 portions of the water. Do not pack the scoop tightly into the powder, otherwise you will use too much powder and you will get too thick a mix. Now we will start the stopwatch because this particular mix should be mixed for 1 full minute. Initially, we're simply only trying to wet the powder. Once the powder has been wet, then we use essentially a stropping action in order to thoroughly mix this material. It will seem rather stiff at first, but it will become less viscous as you continue making the mix. Now, 1 minute seems like a long time to mix, so that you probably should check your initial mixes with a stopwatch to be sure that you are mixing 1 full minute. Material can be collected from around the sides. And you can see that with this technique you should get a nice, smooth, creamy consistency. Now we should be approaching the 1 minute mark. Now we will collect the material and place it in the impression tray. Now generally it's advisable to start from the posterior and add the material and then sort of spread it into the anterior region. You try to have the bulk of the material, or the larger bulk of the material, in the anterior region and not have a lot of excess material in the posterior area. So at this point now you're ready to take the impression. The setting time of regular alginate is approximately 3.5 minutes from the start of the mixing. Most regular alginates will have about this setting time. However, they can vary from anywhere from 2 minutes to 4.5 minutes and still be certified products of the American Dental Association. There are times when a very fast set material is required, particularly when patients have a very strong gag reflex. It's highly important to leave the impression in the mouth as short a period as possible. Therefore, the manufacturers supply you with a fast set material that can be used. This is gel trade fast set and has a setting time between 1 and 2 minutes rather than 3.5 minutes. As a result of this, the mixing time is now 45 seconds rather than 1 full minute. So I'll make a mix now of the gel trade fast set material. Again, we'll be using a 3 scoop mix, so that we'll use a full portion of water, in other words 3 marks on the water dispenser. We'll pour this in again into the rubber mixing bowl. We'll aerate the powder again. Again, we'll dispense 3 scoops of powder. We will start the stopwatch now, and we'll mix for 45 seconds. Again, simply attempt to wet the powder first, and then finally, with a stropping action of the blade of the spatula against the side of the rubber mixing bowl, will give you good mixing of this material. Again, it's wise to collect the material up and then spread it out again over the surface of the mixing bowl. We're now beginning to approach the 45-second mark. We'll discontinue mixing, and we simply then would go ahead and load the tray with this material as you would normally load the tray. You can see that the material has enough consistency so it doesn't readily fall off the spatula, and so that it can be placed in the tray without running all over the tray, the tabletop, and the patient's mouth.
I'd like to demonstrate for you the taking of an alginate impression. We'll start with the lower. We start with the lower because of gagging possibilities and because the lower is easier. Usually if we can get the patient's confidence built up a little bit the lower, then the upper comes that much easier. I'm going to run through this for you in a dry run without any material in the tray, and then we'll mix and place some in it and go through it again here for you. Basically, the lower is taken from the front position, and I'll show you the insertion of this here now. Usually we use one corner of the tray to retract the cheek on one side and use the finger to retract the cheek on the other and insert it somewhat with a rotating motion. And then this is placed down in the posterior on one side and seated as it comes around, pulling the lip out here. It's a sequence that goes rather rapidly, and it's a little difficult to get a full view of all the details on it from the camera angles we're shooting here. We'll mix up a little alginate here. Dr. Craig's gone through the details of the mixing with you on it, so we won't be able to get a good angle shot on this, but you can just see us basically mixing it up here. I'm using this impression without any wax on the peripheries. I'd like to show you that we can take adequate impressions without the wax, although, as I said, wax is nice and can be used. We can't furnish you with it on all your impressions. And in most offices, or in many offices, it will not be available anyways. So you'll need to learn to take them without having wax on them. After we get our tray loaded, some people, including myself, like to put a little water on the top of the alginate just to kind of soothe it out. And you can do this under the faucet or just with a bowl and little fingers. It kind of smooths it out a little bit. And then we'll insert it as we were indicating here, starting with retracting the cheek with one edge, seating it back, and then dropping it into place in a rotary motion here, and keeping the lip pulled out. As we get it seated, we can ask the patient to lift their tongue. And if they want to wiggle it back and forth from cheek to cheek, sometimes this will force that's enough. Sometimes this will force it into the lateral throat form or into the base of the tongue area. Now we'll just let this set for a moment and a half or so. Now that this is set, let's remove it. Before I do, make one mention here. Some people like to have the patient bite down on the lower here just to hold it while it is setting. I usually hold it with my fingers, but you can have a patient bite on it also. Open a little bit now. In removing this, we like to retract the cheek so we can get some air underneath the edge, because this is held in basically by surface tension. And as we take it out with a snap. You'll find as we get along that the alginate is much stronger when we'll take and snap it out. And you'll hear it kind of snap as we come out on it. And then we'll take and inspect this to find out whether we've actually got the areas that we were looking for on it. Let's inspect this closely now. And get a little pointer here and I'll point out. Basically, we've got the peripheral roll pretty well all the way around. We've got a small void right in here, but it's a rather small one. But the anterior area, which is a more important area, we've got a nice roll. You can see the frenum, where the frenum's cut through here rather nicely on this. Coming back to the posterior area, you can see we've got the complete tooth on the posterior, which is the second molar here. We've got down into our lingual throat form area, and pretty much all the way around the lingual area without voids, and pick up the third molar and retromolar pad on the other side. So we've got basically all the anatomical areas that we're looking for on it, and the only real shortcoming we've got on this one is a small void here, which can be rather easily trimmed after pouring. In the clinic, we'll ask that you get these impressions approved by one of the instructors, and once it's gone over and determined that it's a satisfactory impression, then we'll take and wrap it in a humidifier. And basically what we'll do here is just to wrap it in a wet, moist paper towel. This can be kept a few hours this way before pouring. Ideally, it's best to pour it immediately, but practically it's not always practical. So we'll take it and wrap it, leave it in a moist towel until such time as we can get to the laboratory and pour it. Let's demonstrate now the taking of an upper impression. And again, we'll run through a trial into the mouth without any material, then we'll mix our material and place it. Now with the upper, frequently this is placed putting an arm around the patient, open a little, and retracting the lip on cheek on one side and using the corner of your tray to retract it on the other side. And then this can be inserted. And usually we'll place the posterior up first and then allow the anterior to come up, keeping the lip out over the front edge of it here. Now when I take this, I frequently will actually take my hand and tip the patient forward and downward before I insert it. This aids in reducing the gagging tendency. For our demonstration here, we'll leave the patient sitting up straight so that we'll be able to see a little bit better. But this gag can be a problem, and there are 1,000,001 tricks to help the patient get over this psychological barrier. In most instances, it's psychological. I frequently will have them breathe deeply through their nose and try to comfort them and reassure them positively while they're attempting to gag a little bit. Sometimes 2 or 3 sharp gags and they'll roll it out of their throat area or out of the area that's tickling, and it won't be a particular problem. I'll mix this up again. You'll notice I'm adding the water to the powder. This is not chemically desirable and the best way to do it, but if it's done in your office, I wouldn't particularly croak, because sometimes it's the most practical way. And again, you can get relatively satisfactory mixes this way. So this is no real big crime or problem either way. Sometimes it's well to have a cup of water available so that when you remove this tray that you can have the patients rinse. I usually ask them whether they want to rinse or not, and about half the time they will and half the time they don't really care to, because it frequently will come out quite clean. But again, it's a psychological thing. Some people just don't like anything in their mouth, and so we'll need to be prepared. Again, when I load the tray, we try to keep the majority of it up towards the front, and I like to kind of smooth the surface off here with a little water. It seems to help me get less bubbles, but I guess this is debatable. And in inserting it now, we'll start one corner here to insert it. And as we get to the posterior, we'll insert the posterior up first. And then we'll place the anterior, and I usually have a tendency to push it back just a little bit as it goes into place. Now again, with this one, you can either hold it yourself or you can have the patient hold it for you. I'm going to put your thumb up in the roof of your mouth. If you have the patient place the thumb in the roof of their mouth, sometimes they'll be able to hold it and possibly get just a little bit more of self-control and a little bit less of a gagging tendency if they feel they have some control on it. And then we'll just let this set until it hardens. And I might mention while we're setting here a little bit, It depends on the water temperature rather critically as to how long this takes to harden, and it depends upon the purpose for which you're taking it as to how long you let it set. If it's for a study model, which doesn't need to be real accurate, sometimes you can just basically feel when it gets set. And if you've used a fairly warm water, it may set in 30 seconds, or even less sometimes. If you've used fairly cold water, it could go quite a long time. If we're trying to get a real accurate impression, it's best to let it set just beyond the point where it's starting to get tough on it, and you're starting to get some rebound out of it. If you're taking it for a partial denture impression, which you won't be doing as hygienist or some other critical purpose. But for purposes of our impression here, we can just let it set until it gets into our initial phase of set, and then frequently we're capable of removing it and getting an accurate enough impression for our study model. So I think this is almost set for us here under the warm lights and with the water we used. So again, we'll get under the posterior edge of it and try to get the cheek retracted out so that we can get some air under it, and then take it and with a snapping motion try to rotate it down. We'll see if we can get this little snap and pop it out. And then we'll again hold it up here so we can take a look at it and inspect it here again. Again, we'll look to see that we have all the teeth, and we have, right up to the hamular notch area on it. And we've got our peripheral roll pretty well all the way around. You can see our frenum area in through here. But we've got another small void up near the anterior part here, but it's a fairly small one in the anterior, and I'm not too concerned about that again. It's pretty hard to get one 100% perfect, as you'll find out, but we've got to get these voids small enough so that they're easy enough to trim, and they can't involve any of the teeth. And the rest of the periphery is rolled out fairly well. We haven't got any sagging or particularly voiding in our anterior, and we can take a look at the anterior area and see that we have, I'll get it in the camera here, pretty good extension of the teeth. We've got well beyond the teeth on our extension here. So again, this is considered an adequate impression, and we'll place it in our paper towel and go to the laboratory and pour these up for you now. I'd like to demonstrate now the mixing of our stone material or our plaster, whatever you're using. Before we do this, we should trim the excess off of our alginate impressions. Generally, I'll just take the spatula that we have and clip the posterior portion of it off. It's the part that's beyond the area that we're really interested in our impressions. This becomes particularly important if you're using a base former to set your impressions in. And the same with the maxillary, and particularly in this palatal area. This will frequently extend back quite a ways, and unless you trim off this excess, then we can't get it into our base former. Now, on the mixing of our stone or plaster, and here we're going to use stone, a variety of things are used in different offices, and it depends on the office you're in. We're going to use a Yellowstone because it gets a little bit more contrast, and we're also going to ask you to mix and pour a Yellowstone also. It's best if we have this weighed out as far as the weight of the stone and as far as the quantity of the water. You'll find in many offices there isn't scales and graduate cylinders and what have you available, so that you may need to mix this by a judgment factor. Again, it's always best if we add our powder to our water, but this, unless it's weighed out, is not always completely possible. I put a little bit of water in the bottom of the bowl to cover the bottom half an inch or so, and we'll add our powder into this. And if we're going to pour both the upper and the lower together here, we're going to need a fairly full bowl of stone here. So we'll fill her pretty well up. And we've got the bottom pretty well covered, so then we have to start our spatulation. Now, when this bowl is full, you'll find that we'll start adding some water to it here. You'll find that this becomes very easily splashed out. And this is one of the problems we have in the lab, particularly when the girls are starting to mix on this, is that we get plaster, particularly the dry plaster, all over the floor, and then it starts tracking around the lab, and then we've got a path track between the lab and the locker room, and everybody starts getting upset and what have you. But once we've got the powder wetted, then we can start to spatulate a little bit more vigorously. And as I said, this becomes a judgment factor as to how thick and how much powder we actually get into this material. You have to mix rather deep with it, and down well into the bottom of the bowl, particularly if we haven't got this totally added out to begin with here. Like just a little bit more powder in this. We're not quite as thick as we would like. If you add powder and water and go back to powder and water too much, you're going to lose your mixing time and you're going to start to set up rather rapidly here. So you can't waste a lot of time on it. It takes pretty good whipping, strapping type motion on this to get her well mixed on it. And we like to take and vibrate this down fairly thoroughly. See if we can't get rid of as many of the voids as possible, and you'll see some of these bubbles coming to the surface on it. We should have a mix that'll almost hold its own weight now, so that it's not dripping off for us. I like to, in starting to pour these impressions, make sure that they're dried out and there isn't an excess of water in them. And in starting to pour them, use a small instrument. Start in one end on it. We get a close-up on this now? Good. And you can just watch this flow in and out of each of your teeth. Now, if you haven't got a small number 7 spatula or something available like this, you can use the end or corner of your number 7 spatula, but just feed this in small quantities here and watch it as it flows all the way around, right out the other side. And this should flow down and into each of the areas of the teeth. Once we have this well covered in this manner, then you can start to add a little bit more rapidly to your impression, not being quite so worried about collecting voids in it. Usually I'll cover our vibrators with a towel because this does run out, and we expect it to run out, but we expect to keep it on the top and not have it run down all over your controls here. Once we get this filled, then I generally like to take some of this and to place it or pile it on the top so that we actually have this thick enough so that we can build up a little body on the top of this. And you have to play with it a little bit to get it just where you want it. But we don't particularly want it totally flush with the surface. It's a little helpful if we've got this build up and got a little height to it around here. We don't want it run down over the edge of the tray. So we've got this build up a little bit height-wise so that we've got it up beyond the edge of the tray. Now you can set this down and pour your other one, but it's generally not advisable to set this real near your vibrator because your table vibrates or your bench vibrates, it'll vibrate it right out of your impression. Now on the upper here, I generally like to start adding right into the palate area. And again, you can watch this flow down into the teeth, depending on how hard you vibrate it. And usually you watch this flow and we kind of work it around so it'll flow into the areas of the teeth, getting a basic coverage to begin with now of just the teeth themselves. I like to see this flow in and out of every tooth area. Still need some back in the posterior over here. Again, once you've got this covered, then we can start to add it in little larger quantities. And again, we can build up a little extra onto the surface of it so that we'll be able to set this in our base former or into our base without having to set it onto a flat, flush surface. This will just aid you in setting it down. That should be fairly well poured and adequate amount of excess on it for you. Okay. Now we'll mix a little model plaster for the base. Actually, again, we're going to be using stone here for color contrast. Model plaster would be basically the same thing. The water ratio would be slightly different, but this is, we're going to determine a judgment factor. On this we can use probably 2/3, 3/4 of a bowl here to get ourselves fairly full on our bowl, but enough for our base. And again, spatulate gently to begin with so that you're not going to spill quantities of it here on the floor and make a mess. After it's once wet down again, then we can start to spatulate a little bit more vigorously. Frequently the water could be added by standing near a running faucet and then just gently adding a little water in that way, or a little bit on the soupy side here for our purpose. There we got going a little fast, but have to be whipped rather vigorously here now. If you're going to use a little bit thicker mix, you've got to work a little harder on it, and I think this is one area where the gals really don't get their muscles working here and mix and whip this into adequate shape. Once we've got it thoroughly mixed here, again we can vibrate this down, aid in getting rid of our bubbles on it. And we're going to, for our demonstration purpose here, put this on a paper towel. Paper towels, wax paper, is what is used in many offices. It's a little more difficult to do it this way. You'll have base formers and be allowed to set these in base formers also. But you've got to have this thick enough so it'll hold its own weight and it'll stand up. Otherwise, we just end up with a thin little cookie. Again, if we have this poured so that it's beyond the periphery a little bit here, then it's just a matter of taking it and vibrating it into the surface. We've got plenty of excess on this now, and we'll just let this set. If you wanted, you could work it up a little bit around the edge here. Once it has an initial set, then we can take and trim off the excess, which we've got plenty of in this particular one. After this set 2 or 3 minutes, we can trim much of this excess off. To begin with, it's a little soft, so we need to let it set about 2 or 3 minutes, particularly when you're using stone, because this stone trim is very difficult in the model trimmer, and we like to get the bulk of this off right now. And as you learn to trim your models, as we get into that, you'll find out where and how much of this to take off in order to aid you in your trimming. But you can see at this stage, it just rolls off fairly easily here. And it's at this stage here also where we would like to make sure that our tongue space is smooth, save you a lot of time later on, and down below the peripheries of our tray. One of the biggest problems that students get into, and particularly with the stone, is that they get this stone locked over the edge of the tray. And then when they go to remove the tray, it's mechanically locked on and they can't get it off. So at this stage, you can pretty well go around your entire tray and make sure that the edge of your tray is visible or nearly visible so that this tray should be able to be picked off there without a great deal of difficulty. And then we'll have to let this set until it completely hardens, and then we can remove our tray. We mixed a little extra here for the maxillary impression. This is done just a little differently, so I thought I would go through this with you. Again, make a little pile, and if we're using a paper towel, we'll just pile it onto the towel. And we need to set our maxillary tray into it. This can be set into our base when it is soft, or it can be set in when it's hard. If it is hard, we'll need some mechanical retention, and it'll need to be left rough a little bit. And we could moisten this down with a little bit of water, which would aid in our retention also, by putting it in a little bowl or running it under a faucet. And then we'll set this into our material here. With this one now, we would like to have the edge in the front here, our handle, located up at an angle, which will aid in our trimming at a later date. And if necessary, you can take a spatula or your fingers or something and just work the stone up around the edges of it. But again, don't let it get up over the edge of the tray. And we'll just let this harden for a few minutes, then we'll trim the excess off once again. Again, when this starts to harden, we'll want to start trimming the excess off so that we haven't got an unusual amount to trim on the model trimmer. And this can be done fairly easily if you catch it at the right stage. If you let it get too hard, of course, you're not going to get it, and if you take it too soft, then it just pulls it all away. But you can trim the excess off rather nicely, and this will leave us a fairly thick base if we like to work with a thick base, which we're asking you to do in this course. Now, notice we had to mix our maxillary and mandibular separately. If we were to take advantage of a large bowl, such as this, we could probably mix them together and handle it fairly well. This is a heavy-handled spatula, too, which frequently works quite well in the spatulation of this stone, rather than our green spatulas, except this is what we have dispensed to us, and it works adequate, but frequently the heavy spatulas are for the mixing of the plasters and stones. After these have set a minimum of a half hour, then we can take the tray off of our model. First thing we want to do is to check the peripheries to make sure that we have no stone locked over the edge of the tray, and if we do, we can either tap it until it chips off, or we can take it, cut it off with a little knife, but we shouldn't really have much over the edge, and we should be able to take it, and without too much effort, slip it right off here. And we can take a close look at it, see whether we have any voids in it, and this come along quite well. On the maxillary, it should be about the same thing. We'll take an inspection of it, find out whether we have any over the edge, and I think you can see the edge is quite clear all the way around. We kept this clean, and if these are buried in there, it's really going to take a lot of chopping and hacking, but should be able to take it and pop it off. That one come even easier for us. And we come out with a fairly decent model here. Picked up one small void up here in the laterals, the only one. Otherwise, we've got a very complete model on it. So these can be set aside for trimming.
Listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.